Live. I'm here with Dr. Marjorie Hill, the CEO of Gay Men's Health Crisis. We are backstage at the AIDS Walk. You can probably hear the music. It seems like a great event. Yeah, how are you feeling it's going today?
It's a wonderful event. Rain or shine, for 26 years we've had an AIDS Walk, which is part fundraiser, but also part HIV/AIDS education.
And have you been here throughout the whole 26 years?
No, I actually, my first AIDS Walk was in 1990. I joined the board in 1994 and joined the staff in 2004.
Got it. Now with Gay Men's Health Crisis, what does your organization advocate?
Well, you know, we are a social service agency that primarily provides services to people living with HIV, affected by HIV, or at risk for HIV. Essentially, that's almost everyone. But we really, at the core of our beliefs, is that social justice is important. It is the right thing to do. And in fact, social injustice fuels the epidemic.
So would you say that gay marriage fits into the HIV/AIDS crisis as a social injustice that would fuel the crisis?
Well, it absolutely does. Whenever you have family structures that are inequitable, that means that there are families and individuals who get certain supports and rights and benefits and other families who do not. We know that poverty is a driver of HIV, that more poor people have HIV. We know that more people of color have HIV. We know that in many countries, for women, being married makes them at greater risk of HIV. And so because of their status, not because they're married, in terms of being second-class citizens in those countries. So we have lots of evidence that inequalities promote poorer health outcomes, and consequently make disease much more likely. And so to say to one group of citizens, you can't have this right, this benefit, not only is wrong from a justice perspective, but also as a public health intervention, sending the wrong message.
Understood. Now, Governor Cuomo has indicated that he intends to put a same-sex marriage bill on the floor of the legislature during his term. And if it passes, what kind of impact will that have, if gay marriage becomes legal? Will the changes to HIV infection rates take instant effect, or will it be a gradual kind of process towards fewer infections?
Well, I think there's always the challenge of having policy changes and then having those policy changes implemented. It doesn't happen overnight. So that we're very optimistic and pleased that the governor has made this gay marriage, same-sex marriage, as part of his plans for his administration, and we support that. But if it were to happen today, there would still be a lot of work that needs to be done.
Understood. Well, thank you for your time, Dr. Hill. I really appreciate it.